Welcome back. We're continuing our conversation with Trapper Hogberg, who specializes in orthopedic spine surgery. Thanks again for joining us.
Thanks for having me.
Absolutely. So, Trapper, before the break, we talked about some general spine health and back topics. I'd like to get more specific now about some more specific medical conditions. If we could maybe talk about herniated discs, what is it and what are the symptoms?
Sure. A herniated disc or a slip disc or a ruptured disc are all terms that people kind of use. They're most of the time the same thing. What that means is the inner portion of the disc has ruptured the outer portion of the disc, and it kind of comes out into the spaces in between the bones. And this can sometimes push on the nerves that exit in that area, and it can cause some what we call radiculopathy or shooting pains. In the neck, it can go down the arms. In the legs, it can go down into all the way down into the toes. Depending if it's on the right side or the left side, it can affect different extremities. Rarely does it ever go into the face because there are no nerves that innervate the face from the neck. Perfect.
So what is the best way to avoid a herniated disc?
Well, the most common place of herniated disc is in the lumbar spine, because again, that carries most of our weight. So if you lift with proper posture, using your legs, and trying to never twist if you're lifting heavy weights. Also, be cognizant of how much you're lifting.
Thank you. So, degenerative disc disease, or DJD, we all hear that term used quite often. Can you talk about that, and what is that?
Sure. That's when those discs that act as the shock absorbers in our spine, they start to lose moisture over time, and as we get older. This can start to cause the bones to rub together and can cause what we call axial back pain. That's the pain that you can point to in your back. Odds are, if you're around the age of 50 and experiencing back pain, you have some degenerative disc disease, which is causing that pain.
So can you talk to us about how that's diagnosed, firstly, and then how it's treated?
Sure. There's two separate types of pain. Is the axial that you can point to, and the radicular pain that goes down an extremity. Most of the time, talking to your physician and telling them, what type of pain you're having, if you're having numbness or tingling or anything along the lines of that. Most of the time, they'll order an X-ray, and then occasionally an MRI will be needed.
Okay. So osteoporosis, of course, something that does definitely affect people as they age, and even younger people sometimes, depending upon disease states. Can you talk about how that can impact the spine?
Sure. Just like any other bone, they're made up of calcium, and they have a structure to them. As we get older, you start to lose some of the integrity of the bone. They shrink down, and you lose some of the structure of the bone, which can cause the bones to not only shrink, but occasionally fracture. It is very common for elderly women, when they're in their 80s, about 40% of women will end up with some type of fracture in their back.
So how is it treated? How is osteoporosis treated then?
Well, one is trying to never get to the point where you have a fracture. Treating osteoporosis can be as simple as calcium or vitamin D, or it can go up to bisphosphonates or any other medications that your doctor might prescribe. DEXA scan is usually warranted to look at your bone health.
Okay. So if someone's experiencing pain, numbness, or tingling from a back injury and it travels down to their arms and legs, like you've talked about before, what would you recommend? What should they do?
Well, it depends. There's multiple levels. You can have small incidences where you just feel an occasional tingle, but if it gets to the point where it's affecting your quality of life, you're getting weakness, you're tripping, falling, or especially if you're having bowel or bladder changes, things that are significantly weakening, you should be seen sooner than later.
So can we talk about neck sprains, or we also hear it called whiplash, and what are the treatments for this condition? How does it commonly happen, and what do people do for that?
Sure. Whiplash is a neck strain, usually the posterior musculature of the cervical spine. It's usually from a forward motion, which causes these muscles to almost rip and tear a little bit. This can be various degrees. The significant ones can cause a fracture, and then the minor ones can be more of a muscular tear, which can cause quite a bit of pain. Most of these can be treated with formal physical therapy, medication, warm heat, and rest.
And in the whole tear situation, I assume, is surgery ever an option for that? It
can be. It depends to the severity. Most of the time, if it's an unstable fracture of the neck, that will require surgery, or if there's some kind of radiculopathy or what we call myelopathy, which is paralysis or change of the muscles or fingers, that can certainly require surgery.
Okay. So lastly, what is sacroiliac joint dysfunction? We've heard that term, I think, often. And what are the treatments for that condition specifically?
Sure. About 15% of low back pain can be attributed to the SI joints.
Okay.
Down a little bit lower than the lower back. It's where the pelvis attaches to the spine, and the SI joints, they actually act as somewhat of absorbers, but a lot of transfer of power goes through this joint. This dysfunction, like any other joint in your body, can cause a little bit of arthritis or sliding. It can cause significant pain. It's a difficult problem to diagnose, but most of the time is treated conservatively with formal physical therapy, occasionally injections and medication.
Okay. So a lot of great information you've shared with us today. Thank you for doing that. Is there anything in general you would like to say to our viewers just about maintaining spine health? If you had some great words of wisdom just in closing, what would you recommend?
Absolutely. I think just staying active, lifting with proper mechanics. Rarely is back surgery warranted for back pain or anything along the lines of that. So rarely are we seeing surgery. When people show up to my office, a very small percentage of people are sent to an orthopedic surgeon that needs an operation. Most of the time, these things can be taken care of with, diet, activity modification, physical therapy. Warm heat, yoga, Pilates are also great things to do for back pain.
Heard motion is lotion, so that
Absolutely.
certainly reiterates that. Well, thank you so much for being here, Trapper. I really appreciate it.
Thanks for having me.
Absolutely. So up next, what can you do to strengthen your back and have a healthier spine? We'll show you some simple stretches and exercises to support spine health right after these messages. Don't go away.